NeedyMeds users and friends. Thank you for joining me today. My name is Carla. I am the Director of Education at NeedyMeds, and today I will spend some time teaching you how to find patient assistance resources on the NeedyMeds website. Before we get started, I want to go over a few things. You can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel, but no, I will reserve answering questions until the end. If I don't get a chance to answer your specific question during the webinar, I will follow up with you personally via email tomorrow morning. Of course, I'll also provide my contact information at the end should you have any other questions, as well as the contact information for NeedyMeds. I also went ahead and put a PDF version of this PowerPoint presentation in the handout section of your GoToWebinar control panel. If you have difficulty accessing it or downloading it, again, you can simply shoot me a message in the questions section of the GoToWebinar control panel, or you can go ahead and email me after the webinar. So with that, let's get started. For those of you that are not very familiar with NeedyMeds, here's a snapshot of our homepage. And I always put that up because really our website and our call center are the faces of our organization. NeedyMeds is a national nonprofit founded in 1997. Just last year, we were celebrating our 20th anniversary. And we were founded by a retired physician, Dr. Richard Sagel. And Rich is still our president. Basically, when Rich was a practicing physician, he discovered something called prescription assistance programs. And we'll get into that in the very beginning of our webinar. And he wanted every patient and every healthcare professional to know about them. So he created a website. NeedyMeds is an informational resource. Through our website and toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses, including, but certainly not limited to, medications. And one of the most effective and popular ways we do this is with our robust database of prescription assistance programs. Prescription assistance programs are programs that are supported by pharmaceutical companies that offer free name brand medications to those who qualify. There is no law requiring pharmaceutical companies to offer these programs. So when they do offer such a program for a name brand drug, they certainly run their programs differently, and their eligibility requirements will vary. Although they do vary, the eligibility requirements, they are almost always based on insurance coverage and income, and we'll get to that a little bit later on. Your doctor will usually need to be involved in helping you get assistance through a prescription assistance program by both providing the prescription and signing the application. So bear with me while I go ahead and transition out of the PowerPoint presentation and onto the NeedyMeds website so I can show you how to find prescription assistance programs and other healthcare savings options on our website. So one of the easiest things you can do to begin your search is you can type in the name of the drug, be it generic or name brand, in that drug search bar on the top left-hand side. Or you can click on the Patient Savings tab. And this is where we're going to spend most of today's webinar. And as you can see, a whole bunch of different categories come up. And those are all different ways in which you can save on your healthcare expenses. So as I said, to find prescription assistance programs, you can certainly begin by simply typing the name of the brand name drug in that search bar right there. Or again, you can click on the Patient Savings tab and choose the brand name drug hyperlink on the top left-hand side. So let's go ahead and try and find assistance for a commonly prescribed medication in our country, Lipitor. And again, because that's a brand name drug, I'll choose the brand name drug hyperlink. What happens when I click on that is a bunch of icons pop up. What these icons do is they show you what type of information or savings options are available for that drug. For example, it'll let you know if there's a prescription assistance program available, a coupon available, or if there's additional information about that drug. such as support pages, which provide hyperlinks telling you more information about that medication, or quick videos about that drug. You'll also notice that there is a really helpful A to Z index at the bottom. That's to, again, make your search easier. So let's return to our search for Lipitor. Obviously, I'll choose L in the A to Z index, and then I'll scroll down the very long list of medications to see if Lipitor is included. And it is. And when it's listed more than once, which it is in this case, that's because that means it's available in a different formulation. So I'm going to go ahead and click on the top hyperlink for Lipitor, and there are those icons again. The one on the right indicating that there are support pages, which will provide additional information about this medication, and the icon on the left indicates that there is at least one prescription assistance program available. When I click on that hyperlink, you'll notice at the top in this blue bar, it actually says program 1 of 3. That means there are currently 3 prescription assistance programs available for Lipitor. When there's more than one, the program that offers the most assistance will be listed at the top and the least assistance towards the bottom. And they're all set up the same way. At the top, you will always find the name of the sponsoring organization and their contact information. The contact information is important because if you have any questions about this program, you're going to want to be sure to direct them to the program as opposed to NeedyMeds. Underneath that, you will always find the program application section. Most of the time, you will be able to find the application in a PDF version with a hyperlink so that you can complete it and print it out online easily. If that wasn't available, then more information or instructions would be indicated under this program application section. As you scroll down, you'll also see a section for eligibility requirements. Now, as I said in the beginning, eligibility will vary from program to program, but it is almost always based on insurance coverage and income. And because the income requirements are based on a certain multiple of the federal poverty level, we put a handy federal poverty level income calculator right here. And I'm going to really quickly show you how that works so you can see how easy it is. You simply click on that, and you just need a couple of pieces of information. You need to know how much, if you're the one applying for this application, you'll need to know how much your annual income is. So let's say we have an individual applying that makes $47,500 a year, and they're supporting a family of 3. The income that I indicated, you'll notice I only typed in the digits, 47500. Do not put in periods, dollars, or commas. That income is the same number you would put on your tax return forms at the end of the year. And that's all the information you would need. You simply calculate, and then it will let you know what your yearly income is based on the federal poverty level guidelines. In this situation, the results indicate that this individual's yearly income is 232% of the federal poverty level. You simply return to the eligibility requirements section to see if you, your patient, or your client qualifies. And in this situation, this person clearly does. They fall below 300% of the federal poverty level. That's great, but what happens if the calculation showed that this individual was not eligible? Maybe he or she found him or herself just above the eligibility requirements at, say, 305%. Well, when this happens, don't despair. If the income is slightly over the income limit, you can call the program and ask them to make what is called an economic hardship exception. They do that all the time, and believe it or not, if the first representative turns you down, we recommend calling again and re-representing your case. You may find someone with a more sympathetic ear. And at that point, if you are still denied, you can appeal. Well, let's say that the appeal is not successful or the drug does not offer a prescription assistance program. You can actually call the drug company directly and ask them to make an economic hardship exception. Again, believe it or not, this is something that they do all the time, so it is certainly worth your time. Please do keep in mind that we estimate that the application process can take between 2 and up to 4 weeks from the point of submitting the application to actually receiving the meds. So be sure to keep this time frame in mind so you don't put yourself or your clients in a position of missing their medication. And finally, towards the bottom, there's the medication section, and that's important because it will let you know who to send the application to and the details for reapplying. Always check out the text written underneath the additional information to find out some more details that do not fall neatly into the other categories. A tip for healthcare workers: don't print a bunch of applications and hold on to them. Programs change all the time. They close, new ones open. Sometimes eligibility requirements will change slightly. So we recommend getting a fresh application off of the website each time you apply or help a client apply. Now, before we move on from prescription assistance programs completely, I want to return to the patient savings tab and bring to your attention this section called Help with Prescription Assistance Applications. Sometimes these applications can be complicated. So what we've done is we've put together a directory that lists nonprofits that help people apply to prescription assistance programs. And the places we have listed will usually help for free or will assist you for a very small fee. I'm not going to spend too much time here. I just wanted to point this out so you knew it was a resource that was available and so that you can see the search is easy. You can search narrowly by zip code or by state, and then programs will be listed alphabetically by city. Moving along and returning to the Patient Savings tab, I'd also, under the Prescription Assistance section, like to point out our $4 generic discount drug program. This is a directory of all of the discount programs for generic meds available at major retailers. Now, although we call it the $4 generic discount drug program, most will range in price from $4 to $15 for a 30, 60, or 90-day supply. And as you'll start to see throughout this webinar, like the other databases available, there's a number of ways you can search here. You can search broadly by state, you can search by the drug. So I'm going to keep things simple and consistent. I'm going to, throughout this demonstration, choose state searches for the most part. So let's go ahead and click on Florida. The results indicate that there are currently 16 pharmacies in Florida that are participating in the $4 generic discount drug program. And we hope you'll agree that right on your screen is all of the information that you need. In the column on the left-hand side, you will find the store name and hyperlinks if available. And you'll notice as my mouse is scrolling over these different pharmacies, certainly all of the large national major chains are included, such as Costco and CVS. But you'll also notice there's a lot of smaller or neighborhood or regional pharmacies that participate as well, such as Good Neighbor or Navarro Discount. The center column indicates the program name, and most importantly, the column on the right will let you know the details of what this program offers. Now, as I said, we call it the $4 generic discount drug program, but you can see some of the prices are a bit more expensive, but for the most part, they do stay between the $4 and $15 for a 30, 60, or 90-day supply. So let's move on to another helpful section of the NeedyMeds website, also under the Patient Savings tab, which is the free, low-cost, and sliding scales clinic database. I am so pleased to let you know that this database, because it has grown so much, is now broken down into 4 categories. Not only do we have medical and dental clinics, but we also have sections dedicated to specifically for mental health and substance addiction clinics. Now, these databases are set up exactly the same. So just for purposes of demonstration, I'm going to click on the medical clinics. But again, they're all set up the same way. As you can see, there are more than 15,000 free, low-cost, or sliding scale clinics throughout our country included in this database. Medical clinics are a great option for those, let's say, with medical but not dental coverage, for those who may find themselves without a primary care physician, and certainly an alternative to an emergency room visit for those who might visit an ER not because it is necessarily a medical emergency, but maybe because they feel they have no other option. As you can see, like the other databases, there are a number of ways to search. And although I said I'm going to mostly stick with state searches because this database is so robust, I'm going to go ahead and do a zip code search. So let's say this individual has access to public transportation or is luckier than me and they have a car, so they can get 10 miles within the zip code of 23223. I simply put in the zip code, check the distance that I can travel, click on search, and the results indicate that there are 21 free, low-cost, or sliding scale clinics within 10 miles of the 23223 database. And let's talk about the snapshot of information you're looking at on your screen right now. The far left-hand column, the print column, we're going to get to in just a moment. So let's talk about the clinic column. As you would imagine, in that column, you will find not only the name and address, but also the phone number and hopefully a link to the clinic's website if one is available. The center section is really important because it'll let you know the eligibility, meaning who can be treated at the clinic. It also lets you know about the fees. This one happens to be a sliding scale clinic. That's something important you're going to want to know before you head out the door. Is this clinic going to be free, or is it going to cost me a little bit of money? The right-hand column, details, indicates the services that they include, the hours they are open, and the service area for which they serve. A couple of things, actually, I want to point out. You'll notice that oftentimes medical clinics will have additional services, social services, dental services, and some even provide transportation. As far as the hours go, although we absolutely pride ourselves on the information on our website being accurate and up to date, we always recommend that you reach out to the clinic by calling them or visiting their website to make sure they are open and to confirm any other details that are pertinent to you. And the service area lets you know where you have to reside to be treated at that clinic. And some of them are a little bit more broad, such as Richmond area, as opposed to simply Richmond. So keep that in mind. Now, I mentioned the print column on the far left. Now, let's say you want to print out a list of clinics for a family member or patient or client. You can certainly choose the print all option, and it'll do exactly that. It'll print out this list of all of 21 clinics. Or you could narrow down the list further by simply putting a little check mark in the box on the left-hand side of the name of the clinic, and then choosing the print instead of the print all option. This will generate and print a list only including those you choose. So that's a great tool also for healthcare professionals that may want to provide their clients with a list of clinics for them to choose from. Another important and popular database on our website is the Coupons and Rebates database. This is where you can find prescriptions and over-the-counter medications or supplies for which there is a coupon, a rebate, a discount, a free trial, or a free sample. Like the other databases, there are a number of ways to search. You can search for the brand name. You can search for the product name. But in the coupons database, you can also search by category, which indicates the ability to search either by diagnosis or field of care. Now, I'm going to go ahead and choose the hyperlink for blood pressure, just so you can see an example of what this coupon database will look like and what it offers. So a really important thing is right at the top, there are those icons again that also appeared in the prescription assistance programs. That's really helpful because that means that this database will certainly let you know if a coupon is available, but it will also let you know if there's another cost savings program, such as a prescription assistance program, or whether it's available through the $4 generic discount drug program, or whether there's additional information about this drug, such as information called short drug info, which is exactly that, very quick and detailed information about the medication, or drug videos. So let's scroll down just so you can see how these listings are indicated. I'm pointing this out because we recently updated the coupons database. We used to just have a paragraph or a couple of sentences describing what this cost savings program offered. That was a little bit difficult to read, so we changed it to a bullet point way to present the information, and people have responded that they really do prefer this. Please be vocal about what's working for you and what's not working for you on the NeedyMeds website or regarding the programs we offer. We really consider all of our users partners. So we cannot improve what we're doing or expand what we're doing in response to what you need unless you're vocal about it. So please do keep that in mind. We also always include a hyperlink to the manufacturer's offer on their website. And we also put a really convenient way to request a NeedyMeds drug discount card. You can print it, you can email it to yourself, or you can even text it. And of course, later on in the webinar, we'll get into more details about what exactly the NeedyMeds drug discount card is. So hopefully at this point, you're starting to see that the NeedyMeds databases are set up similarly. That's purposeful. We want to make the website as easily negotiable as possible so you can find what you need within a few clicks of your mouse. With that being said, please don't ever hesitate to reach out to our expert call center counselors at 1-800-503-6897. They are available Monday through Friday, 9 to 5 Eastern Standard Time, and we do have Spanish-speaking counselors as well. Now, returning to the Patient Savings tab, aside from the prescription assistance programs, the second greatest source of savings is through our diagnosis-based assistance programs, which you can find in the center section. So I'm going to go ahead and click on that hyperlink. Diagnosis-based assistance programs provide financial assistance for costs associated with a particular disease. Now, this database is different because for the most part, it does not include medicines. What it does include instead are other necessary medical expenses. For example, maybe you're looking for medical supplies, durable medical equipment, testing supplies, or maybe you need help affording something like a wig or house cleaning services or assistive technology. So basically anything that doesn't fall under the NEAT category of medications, you can try and find cost assistance under the diagnosis-based assistance programs databases. So like the other databases, there are a number of ways to search. You can search by probably the least common program name. You can search geographically, or in this case, like the coupons database, you can search by diagnosis. And there's another helpful A to Z index because this database is so chock full. I'm going to choose D for diabetes, and I always use diabetes as an example when I'm talking about diagnosis-based assistance programs. And I do that because not only is diabetes a commonly diagnosed condition in our country, but because it's a great example of a diagnosis that really requires a lot of expense in addition to medications. A lot of diabetics need things like testing supplies, testing strips, needles or syringes, or assistive technology. Because diabetes is such a broad category, it's broken down into a number of different subcategories, but for the purposes of this webinar, I'm just going to click on the general hyperlink for diabetes. There are currently 62 diagnosis-based assistance programs for diabetes. And let's talk about what's on your screen again. And this is set up similarly to the other databases. A neat little array of columns providing what we think is the most pertinent information. The left-hand side is the program name and a hyperlink to that program if it's available. Excuse me one moment. And then next to that is the summary section, which is exactly what it sounds like. It's a summary about that program name. Now, most importantly to you are the two columns on the right-hand side. Services provided lets you know exactly what this program offers. And as you can see, it really does vary greatly. Many of them do offer medical supplies or durable medical equipment, but look at this. Some of them often offer help with respite care. Some of them offer help getting a service animal. Some of them offer service, offer assistance for treatments and procedures. And the right hand side indicates the area of service. And what that means is that lets you know where you need to reside to be eligible for these programs. And you'll notice all of the national programs, meaning regardless of where you live in our country, you are eligible to apply. And then all of the programs are listed alphabetically by state. Now, since we're on the topic of finding assistance through diagnosis, I want to point out something called our diagnosis information pages. I'm not going to spend too much time here. I just wanted to make sure that you knew that these were available. These are a great destination for somebody that's been newly diagnosed. And they're exactly what they sound like. They are informational or educational pages dedicated to specific diagnoses. Our goal is to partner with reputable organizations like other nonprofits so that they can provide the most comprehensive information about a particular disease. And as you can see, the diagnoses are listed per category and then alphabetically. So I'm just going to show you an example of what one of the pages looks like. Don't worry about reading the text. I'm going to make it really small. I just want you to get a sense of how they're set up. On the top, you'll find the name of our partner for this page. The center section will let you know some information about that diagnosis. The right-hand box, resources, provides exactly that, additional and reputable resources. But what really differs the NeedyMeds diagnosis information pages from other informational pages on the internet are that we also keep a list of medications commonly used in the treatment of this diagnosis. And you can see as I scroll my mouse over them, they're all hyperlinked. That's because it'll let you know whether or not there is a prescription assistance program available for that medication. So we think these are really handy, so I just wanted to make sure you were aware that they existed. Now, also under the diagnosis-specific section, I'm going to skip over the middle for just a moment, the medical transportation. I'll get there in just a moment. But I want to now point out that we do have two other databases where you can search for assistance by diagnosis. We have whole databases dedicated to retreats, camps, recreational programs, and scholarships, and that refers to educational scholarships for people living with a particular diagnosis. Now, I'll let you know that I don't think many people come specifically to NeedyMeds or call our 800 number to find a recreational program, an educational scholarship, or camp. But it's something that we found in our research, so we figured we might as well spread the word. And it's worth checking out the databases. You may find some assistance for yourself, a family member, or a client or a patient that you didn't even know existed. So before we move on away from the diagnosis specific section, I want to point out one of our most newly updated sections of our website, which is our medical transportation section. And that's exactly what it sounds like. If you need help getting to and from your doctor, your hospital, your specialized facility, your physical therapy, which is often a problem, check out our medical transportation section. It's broken up into travel expenses, which usually refers to taxis or private taxis or car services or something that you can handle on your own and be reimbursed for or get a voucher for. Transportation services usually refers to having the transportation set up by that point of care, such as a wheelchair accessible van provided by your hospital or specialized facility, or some other transportation service offered by that point of care. You can search by both diagnosis and then narrow it down to see what's available in your state. So I'm just going to do a broad search for cancer. And you'll notice what happens is once I start typing in the name of the diagnosis, it prompts you to, it prompts the search bar to pull up additional diagnoses that are spelled similarly. So let's say we're looking for help, medical transportation. We have some medical transportation needs for a loved one in the state of Massachusetts that's living with cancer. And it's as easy as that. There are currently 6 programs in Massachusetts, and like the other database that we just reviewed, the diagnosis-based assistance databases and other databases, the programs are listed geographically with the national programs listed at top and the ones for the state listed at the bottom. So let us know what you think of this website, this section of our website. It was just added maybe about a month ago, and we're getting a lot of positive feedback. Returning once again to the Patient Savings tab, I also am not going to spend too much time here, but I wanted to make sure that you are aware that we have an entire section dedicated to government programs. Now, certainly this is a great resource for people who are seniors or who work with seniors, because we have a lot of the Medicare or Medicaid information that you'll need. But we also have all of the state-sponsored programs throughout our country. So it's definitely worth checking this out. And again, you can do a search, obviously, because these are state-sponsored programs according to the state you reside in. So feel free, I do see some questions coming in, so feel free to go ahead and submit your questions if you have any. And in the meantime, I'm going to go ahead and transition out of our live website to our PowerPoint presentation so we can talk about another important way to save money, which is through the NeedyMeds drug discount card. And I went ahead and I just put a list of the cost savings resources we covered. And I really wanted you to have that as part of the PowerPoint presentation that I uploaded in the handout section of your GoToWebinar control panel. So let's talk about the NeedyMeds drug discount card. With our card, users can save between 0 and up to 80% off of the cash price of prescriptions, over-the-counter medications and supplies as long as they're written as prescriptions, and even pet prescriptions if you pick them up at the People Pharmacy. Not every product is discounted, and the NeedyMeds drug discount card only works for brick-and-mortar pharmacies. It's not accepted online. And we're happy to let you know that the card is used 85% of the time it is presented to the pharmacist. So let's talk about who can use the NeedyMeds drug discount card. And the simple answer is anyone. The only rule is it cannot be combined with insurance. So if you're uninsured, you can use the card anytime. If you do have insurance, you may choose to use the card instead, because maybe you find that your medication, that particular medication, is not covered under your insurance. Maybe you find that your copayments are too high. Maybe your deductible is too high. Maybe you find yourself in a coverage gap, like the Medicare Part D donut hole. Or maybe you've exceeded a cap for drug coverage for the year. So importantly, let's talk about how you can get yourself a free and anonymous NeedyMeds drug discount card. And I'll point out some tools to help you optimize or maximize those savings. So returning to the NeedyMeds website, there's a number of places on our website where you can find our drug discount card information and how to request one. But very simply, on the left-hand side of our homepage, there's that box with the red arrow that very clearly says get your NeedyMeds drug discount card, and it will bring you to this page. On this page, you can click on the downloadable PDF, and all you would have to do is print this and cut the card out. You can fill out this form, being sure to choose the design you prefer. You can mail us a request with a self-addressed stamped envelope, and we'd be happy to drop a drug discount card in the mail for you. Or once again, you can call our counselors on our toll-free helpline, which is 1-800-503-6897, and they'll be happy to drop a number of drug discount cards in the mail to you. You can also download for free the NeedyMeds app, drug discount card app, through something called our Storylines app. This is great. Storylines is a free self-care app that makes it easy for you to track and manage your health conditions. And you'll notice, because this is new, we're providing the first 100 registrants on the app a $10 Amazon gift card. So please be sure to download that app for free and get started with it right away. I've been using it myself, and it's a great way to track everything from your mood to your medication to your health and to your weight. And on this Storylines mobile app, you'll also find a really easy to find, actually, digital version of the NeedyMeds drug discount card. So you'll always have it with you when you get to the drugstore. So I can't stress that enough, that I hope you do take advantage of that. So we talked about where and how you can request a NeedyMeds discount card. Let's talk about how you can maximize savings with the NeedyMeds drug discount card. One of the things you want to do right off the bat is find out what pharmacies in your area accept the NeedyMeds drug discount card. I'm happy to let you know that our drug discount card is accepted in more than 65,000 pharmacies across the United States. And that certainly includes all of the major chains, as you saw a little bit ago, like Costco and CVS and Walgreens, but it also includes local chains as well. Now, you'll notice I did return to the NeedyMeds drug discount card page. At the very bottom of this page, you'll find our pharmacy search. All you need to do is type in a zip code. And I'm going to go ahead and type a zip code in for where NeedyMeds is and where I live. And you go ahead and I'll say, let's say we have access to 15 miles within that zip code. And there are 41 pharmacies within the zip code of 01930 where NeedyMeds is located. And again, all that pertinent information is right on your screen now, including a name, address, and phone number of that pharmacy. So what that means, and again, like the other database where gives you a print option, the clinics, you can also do the same thing here. You can print all of these pharmacies if you want to hang on to them or share them with a loved one, neighbor, patient, or client. One other thing I wanted to point out about these pharmacies that are listed, if the pharmacy is listed here, that means that they're contractually obligated to accept the NeedyMeds discount card. Once in a while, somebody will run into a pharmacist that's new, is not aware that they're supposed to accept it, and if that happens, and it's an outside chance that it will, but please know, in the event that it does, you can certainly call NeedyMeds, but there are also phone numbers on the back of the card that you can call or the pharmacist can call to confirm that. Okay, so now you have your NeedyMeds drug discount card. You're armed with a list of pharmacies that you already know accepts the drug discount card. The next important thing is, how much is that medication going to cost? To find that out, you simply click on the drug pricing calculator on the top left-hand side. We updated this drug pricing calculator a few months ago because the one we had here originally, people found a little bit clunky. I'm not going to walk you through this whole thing. I'll just let you know 4 pieces of information are needed. You'll need to know the name of the drug, the dosage, the day supply, meaning are you picking up a prescription for 30, 60, or 90 days, and the zip code with which you'll be picking up, the zip code where you'll be picking up the medication. And that will give you an estimate of how much that drug will cost you. 2 quick things I want to stress. You heard me say estimate. The reason I say that is because although it is a very close estimate, it will not be accurate down to the dollar. Also, as I mentioned before, I think I did, and if I didn't, I will say it now. Prices for drugs vary literally all the time. So if you are checking out what the drug costs you today, you're going to want to go and pick it up today. Don't look at what the drug costs now and pick it up a month from now, because the chances are that price will change. Will it change dramatically? Probably not, but it could. So hopefully you will find this useful. Now you've got your drug discount card, you've got the list of pharmacies, and you know how much that's going to cost you. And I can tell you, as somebody living in Massachusetts through this, negative, below freezing temperature for a couple of weeks, I don't want to make an extra trip out of the house unless I know that I'm going to be successful when I get there. So I do see other questions coming in, which is fantastic. So bear with me while I once again escape out of the NeedyMeds website and return to our PowerPoint presentation. And while I answer some questions, while I answer some questions, I just want to put up here some of our other upcoming special topic webinars that I do hope you'll join us for. And all of these webinars you can sign up on the NeedyMeds calendar of events, which is in the bottom right hand of our homepage. So let's get to these questions. The first question is a really important one, and a lot of people ask whether or not Medicare Part D recipients may not be eligible for some PAPs. Unfortunately, that is true. I want to point something out, so bear with me while I escape out of the PowerPoint presentation for just a moment. Let's return to the Patient's Assistance tab and click on the brand name drugs. Let's return to our search for Lipitor. I'm choosing L in the A to Z index, and then I'm scrolling down to find Lipitor once again. There's that icon letting me know that there is at least one prescription assistance program available. So here's the great thing, and thank you for bearing with me while I answer your question. But for me, it's always much, I find I learn more quickly if you can show it to me instead of tell me. So you'll notice under the eligibility requirements section, let me make the screen a bit bigger for you. There are a number of questions that we have answers to. And one of those is whether or not this person with Part D is eligible. So the great thing is that you will know right away whether or not it's worth your time to apply to this prescription assistance program. This particular prescription assistance program, this person is able to apply even though they have Part D. Let's take a look at the next one. So this one is determined on a case-by-case basis. And let's see the next one. Here, this one, no, they are not eligible if they are in Medicare Part D. So the answer is, unfortunately, yes, you're right. Recipients sometimes may not be eligible if they have Medicare Part D for PAPs. But as evidenced by this quick search for Lipitor, that's not always the case. So the great thing is, as I said, you'll know immediately whether or not it's worth your time to reach out to the prescription assistance program or not. I also recommend, like I said, calling our expert counselors on our 800 number. The reason I recommend doing that is certainly they'll let you know those eligibility requirements over the phone, but if you strike out and you are not eligible for that particular prescription assistance program, they will do their best to try and find you another program that you may be eligible for. So let's go back to the coupon database because someone was asking how to print a coupon. So I actually did not specify that. What was in the coupons database on everyone is how to print out the NeedyMeds drug discount card. But let's just go ahead and return to the coupons database and click on blood pressure and see what happens. So if a coupon is available, you will see this icon right here with the scissors. If you don't see that, it means one is not available. So let me see if I can find one that is available. Bear with me. I'm still looking. So let's see. Let's return. Let's see if I can just click on this link. Bear with me a moment. I'd love to show you an example of what a coupon icon will yield. So hopefully, as you can see, I'm not having luck with it. Actually, I'm kind of glad this came up because one of the really important things I want to point out is that the thing about NeedyMeds is that our vision is affordable healthcare for all. If you're turning to NeedyMeds, that means that you don't have the luxury of that, as most people don't. So our first goal is to connect you with what will provide you the most cost savings programs, and that will always be prescription assistance programs. If we can't find a prescription assistance program for you or a diagnosis-based assistance program, then we move on to the coupons. If we don't have luck finding you a coupon, probably our last resort will be the NeedyMeds drug discount card. So once again, if you are looking for print out a coupon, what will happen is you'll see this icon and you'll be able to click on it, and it'll be as easy as that. And again, if you do have difficulty, don't hesitate to call our 800 number. So here's a great question, and one we get regularly, so regularly that I should make sure to include it in my regular presentation. The NeedyMeds drug discount card is completely free and completely anonymous. What that means is there are no residency requirements at all. All you need is a valid prescription and the drug discount card, and you can have that in a plastic card that we mail to you. You could have printed it out and cut out that card, or you can have it on your phone. So you do not need to be a U.S. citizen, and you do not need to have any residency that's provable to use the NeedyMeds drug discount card. That's an important question. Another great question we get is whether or not we have a category of resources for people who have nutritional needs not covered by insurance or food stamp programs, such as liquid nutritional drinks, Boost or Ensure, things like that. So what I would say to you is where you're going to want to check that out on the NeedyMeds website is under the DiagnosisBased Assistance Programs database. And you can check it by diagnosis. If we have any, they will be listed there, but we do not have a specific section dedicated to only that need. So let's see. An audience member, thank you for this comment, is finding that sometimes drug discount cards require an expensive copay. I'm not sure if you're referring to the card itself, like that you have to pay to use the NeedyMeds drug discount card, which you don't. But if you mean that when you use the drug discount card for your copayment, it's still expensive. Unfortunately, there is not a way to work around that. The NeedyMeds drug discount card, although we pride ourselves on the fact that we have saved people since its inception almost $230 million since August 2009, and it provides a discount 85% of the time. It is presented to the pharmacist. Usually, it will provide the average discount it provides is half off of what you would pay in cash. Now, half off is great, but it's not so great if your expensive copay is $500. So unfortunately, the answer is no. But again, reach out to NeedyMeds, check out our website to see if there is another cost savings program available. So here's a question about eligibility. Whether or not eligibility determination is based on total family income or the patient's income only. It is pretty much always based on the patient's income only, but if you have a question about that, and this is a big sort of disclaimer I want to say now, I would recommend calling the organization that sponsors that program. The reason is that I had said in the beginning of the webinar, and probably repeated way too many times, is that eligibility will vary from program to program. So to err on the side of caution and not go through the trouble of filling out and submitting an application, I would certainly, on a case-by-case basis, give them a call. So here's a great question, whether or not NeedyMeds offers something called a prescription drugs for dummies class. This is it. The NeedyMeds overview webinar, I would say, is the closest we come. But that's a great suggestion, and we might actually steal that from you. But please do continue to check out other resources that are not only on the NeedyMeds website, but also every couple of months, I would say, if you have the time, please participate in a NeedyMeds overview webinar. Check out our calendar of events, the bottom right-hand side. We do our best to make it chock full of briefs that drill down into specific NeedyMeds programs, overview webinars, and as you can see, a whole bunch of special topic webinars. So that's a great way to stay up to date, not only with what's going on with NeedyMeds, but important and timely healthcare topics. Another way to stay up to date is with the NeedyMeds blog called the NeedyMeds Voice. My colleague Evan writes most of this, and he is an unbelievably talented writer, so please do check out the NeedyMeds Voice. And there's tons of other ways to stay up to date with NeedyMeds and healthcare in general, which is by checking out the Advocates tab. Please do that. Check out our webinars. Sign up for our monthly patient assistance newsletters. Request that we mail you some materials. We'd love for you to stay up to date. But thank you, and that's a wonderful question. So let's see. So here's a great question too, and one we get regularly. How quickly is our database updated when a drug changes to generic, for example? So that's a tricky one. We say that we update everything on our website at least every 3 to 6 months, 6 months being on the outside. But for example, we have a team of, I want to say 3, I think it's 3, but definitely 2 full-time staff members that are dedicated specifically to keeping our prescription assistance program database up to date. So I'm always hesitant to say immediately. I would say within a couple of months at the most, but really we always do a lot better than that. Certainly, and I can't stress this enough, I had said earlier on, we consider every user a partner. If there is something that you're aware of that we don't know about or something looks out of date, pick up the phone, give us a call, or drop me an email. We deeply appreciate it. So let's see if I have any other questions coming in. Another great question. We get this regularly. Whether or not NeedyMeds offers any courses that offer CEUs or continuing education units. Unfortunately, we don't. What we do offer, however, is under the Advocates tab, we have something called the Patient Assistance Resource Education Course and Exam. This is a web-based, self-paced tutorial designed to teach healthcare professionals about NeedyMeds, what we are, the resources we offer, and how to find what you need on our website. Once that is completed, we do offer a certificate of completion for your professional portfolio, but unfortunately, we do not have the ability to offer CEUs. Usually, as you can see, that's indicated somewhere, we charge $15 for the Patient Assistance Resource Education course and exam, but I would be more than happy to waive that fee for anybody who participated in today's webinar. Just shoot me an email and let me know, and I'd be happy to send you those links as a thank you and complimentary. So let's see. I think that pretty much covers everything. Bear with me for a moment while I just put up, before I leave you, our upcoming webinars that I do hope you join us for. And there's some contact information for you. We really welcome any feedback you'd like to share, and we hope that you put that up on the Great Nonprofits website. You can just Google Great Nonprofits, and then they'll have a search bar where you can type in NeedyMeds. If you have any questions about this webinar, anything I covered, you can feel free to email me directly. Again, my name is Carla. I'm the Director of Education. If you're looking to receive some NeedyMeds drug discount cards, educational materials, or brochures, you can drop my colleague Alana an email. And again, please don't hesitate to reach out to the NeedyMeds toll-free helpline at 1-800-503-6897. We're here to help. Thank you so much for your time, and here's wishing you, your family members, your loved ones, your clients, your patients, a really happy and very healthy 2018. Thanks so much for your time. Have a great rest of the day.